Azathioprine is a drug that is used in autoimmune conditions like rheumatoid arthritis. It can also be used to reduce transplant rejection. And when it is taken up by the body, it is converted into the molecule 6-mercaptopurine. And 6-mercaptopurine can then be converted into 6-theoguanine active metabolites. And so these metabolites are going to have the therapeutic effects of azathioprine, and they work by inhibiting cellular proliferation. So they're going to ultimately decrease purine synthesis, and there's two ways in which they decrease purine synthesis, and we're going to talk about that in the next slide. But before moving on, let's just quickly point out that allopurinol and febuxostat are going to be drugs that we use in treating chronic gout, and they work by inhibiting xanthine oxidase. And one thing that we want to keep in mind is that 6-mercaptopurine is going to be metabolized by xanthine oxidase. So as a result, if we are using these two chronic gout drugs, we want to make sure that we reduce the levels of azathioprine because we're going to be metabolizing less of it to make it inactive. So let's move on to the next slide and talk about how 6-theoguanine is going to decrease purine synthesis. So they're going to do that by inhibiting the enzyme PRPP aminotransferase, which is an enzyme that is important in purine synthesis. The second way it is going to accomplish decreasing purine synthesis is by embedding itself into the growing DNA and RNA strand. And by doing that, it is going to make these growing strands inactive. So this is two ways in which they can decrease purine synthesis. So sometimes azathioprine cannot target the growing cells that we want to target. And so what it can actually do is it can also, as a side effect, reduce our red blood cells, white blood cells, as well as platelets. This is called pancytopenia, and it is a really dangerous side effect of azathioprine. And so in the next slide, I have this question: what should you be periodically monitoring if the patient is taking azathioprine? And the answer is going to be CBC, because we want to make sure that the patient does not have pancytopenia from taking this medication. And so we want to look at their white blood cell levels, red blood cell levels, as well as their platelets to make sure that they don't have pancytopenia.